Hello, the first thing we're going to do today in this assessment is perform hand washing. Introduce yourself to the patient and identify the patient. So my name is Juliet, I'm going to be your nurse today. We're going to be performing an eye, ear, nose, and throat assessment. Can I have your name and date of birth, please?
Yes, Adrian, 1989, August 7th.
All right, thank you. Everything matches. And so the first thing that we're gonna be looking at is the eyelids, the patient's pupil, iris, sclera, which is the white part of the eye. We're looking that there's no swelling and that the sclera is white, no redness. We're gonna pull the eyelids down and ask the patient to look up. We're gonna see that the conjunctiva is pink and that there's no redness or swelling, and there isn't. Very good. So the next thing that we're gonna do is we're gonna look at the pupils and make sure that they're the same size, that there's no anisarcoma and no strabismus. We're gonna measure the pupils. Normal pupils are usually 3 to 5 millimeters, and his look like they are 3 millimeters. So it looks normal. First test that we're gonna do is the pupil eye reaction. So we're gonna dim the lights and we're gonna test that the pupil contracts. Can you please look over there? There's no more contraction. Right, so the pupil contractions are good. They're round, equal, and responsive to light. The next thing that we're gonna do is the visual acuity test. So you can test that with the Snellen chart to make sure that the patient has 20/20 vision. You're gonna put the patient 20 feet away from the Snellen chart and test their visual acuity. You can also do the near vision test, which you can test with a near vision card 14 centimeters away to test the patient's visual acuity for nearness. And next we're gonna do the 6 cardinals, make sure the ocular movements are working fine. And I'm gonna ask you to please follow my pen. Alright, so he has normal movements. And the last thing that we're going to test is the patient's accommodation. I'm going to please ask you to look at my pen and follow it. Alright, and that's normal. That completes the eye test.
Good morning, my name is Adalberto. I am going to the ER assessment for the patient. What is your name?
Adrian.
Adrian. I am going to look your ear because I need to inspection and palpation the auricle. I need looking the erythema, swelling, skin infection. If everything is normal, we are going to use the otoscope. Otoscope is introduced in the ears and pull the auricle up and back because you're looking better the tympanic membrane and the ear canal. The tympanic membrane is when it's normal is the color pearly gray, shiny, and translucent.
Hello, my name is Adrian, and I will be performing a nose and mouth assessment. So we first ask the patient, we identify the patient, we put on gloves. What's your name?
Juliet.
And so we want to check the wristband, everything checks out. Okay, Juliet, so I will be performing an assessment on your nose and your mouth. First thing we do is we inspect the patient's nose. We look that is midline to the face. We also look at the nostrils to make sure there's no blockage. And we also look for septum deviation. which she does not have any. Everything looks clear. We also check with the pen light further in the nostrils to make sure there's no blockage. I don't see anything right now. So we also asked the patient if she's been having any problems with her nose, any drainage, any blockages. So she says no. The next thing we do is we ask the patient to cover one nostril and blow out. Can you please do that for me? So I hear air, so that's a good sign that there's no blockage and the nostril is patent. Can you do the other side now for me? I also hear air on the other side, so everything checks out with the nose. Next, we move on to the mouth, making sure that her lips don't have any sores, any signs of cyanosis, dealing with O2 saturation. We also want to ask the patient to open her mouth to check inside. You can use the pen light if you want to make sure that her soft palate and hard palate are normal with no lesions. We also look at the side, check the teeth for any signs of cavities. Very important, we ask the patient to lift her tongue to see if she has any masses or any lesions again. Everything looks clear. And the last thing we ask the patient is to please open your mouth wide and extend your tongue out to look at the position of the uvula to make sure that it is midline. Everything looks clear, it is midline. And with that, we conclude our assessment of the nose and the mouth. Thank you.